Every 34 seconds, someone in the United States dies from heart disease. In 2023, that amounted to more than 915,000 lives, more than cancer and accidents combined. Death rates dipped slightly from 2022 to 2023, and medical commentators frame this as progress. Dr. Mercola takes a different view. When the most common cause of death in the country declines by a fraction of a percent, the more relevant question is not whether the trend is moving in the right direction, but whether medicine has been addressing the right causes at all.
Welcome to Dr. Mercola's Cellular Wisdom. Stay informed with quick, easy-to-listen summaries of our latest articles, perfect for when you're on the go. No reading required. Subscribe for free at mercola.com for the latest health insights.
Hello and welcome to Dr. Mercola's Cellular Wisdom. The historical pattern is what makes Dr. Mercola's case most clearly. The rise of heart disease as a leading cause of death in America followed the widespread introduction of industrial seed oils into the food supply, but with a delay. That delay is roughly 10 to 20 years, which is exactly the timescale over which arterial damage builds silently before producing symptoms. The correlation between seed oil adoption and the later rise in cardiovascular mortality is not incidental. It follows the biological timeline of how linoleic acid, the primary fatty acid in seed oils, accumulates in and damages tissue.
Linoleic acid does not behave like saturated fat inside the body. When consumed regularly and in the quantities typical of a modern diet, it incorporates directly into arterial walls and into the lipid particles that carry fat through the bloodstream. Once embedded, it oxidizes, essentially goes rancid inside the body during ordinary metabolic activity. Oxidized linoleic acid triggers chronic inflammatory responses, attracts immune cells to arterial tissue, and progressively weakens the structural integrity of the plaques that form in response to that inflammation. This process does not cause pain. It reshapes artery biology year after year while the person feels completely healthy.
The medical advances that did produce genuine improvement in outcomes deserve acknowledgement. Faster emergency response systems, bypass surgery, angioplasty, coronary stents, and clot-dissolving drugs have dramatically improved survival rates after a heart attack in the hours immediately following the event. Dr. Mercola notes that these interventions are genuinely life-saving, but they operate on the acute presentation of the disease. They do not reverse the underlying tissue damage that accumulated over decades, and they have no effect on the ongoing exposure to the dietary inputs that drove that accumulation in the first place.
The statistical picture contains another layer that medicine tends to interpret as pure progress. Life expectancy in the United States rose from around 71 years in 1970 to approximately 77.5 years by 2022. As more people live longer, more people live long enough to develop heart failure and cardiac rhythm disorders, conditions that previously killed people before they could manifest. Dr. Mercola points out that a portion of the rising rates of heart failure and arrhythmia reflects survival success rather than failure. People who would have died earlier from acute events are now living long enough for these later-stage conditions to emerge.
The most significant recent development in this space is a policy-level shift. The 2025 to 2030 United States Dietary Guidelines represent the most substantial revision of American nutritional policy in decades. The new guidelines move toward emphasizing full-fat dairy, eggs, meat, and other whole food fat sources, and away from the industrial fats that dominated dietary recommendations for the previous 50 years. Dr. Mercola views this as a delayed but meaningful course correction, an acknowledgement embedded in official policy that the fat-phobic era produced harm rather than the cardiovascular protection it promised.
The practical framework Dr. Mercola outlines centers on three inputs. The first is seed oil elimination, removing the dietary source of linoleic acid that accumulates in tissue and drives the oxidative arterial damage the emergency medicine system is now very good at treating. The second is metabolic health support, stable blood sugar, adequate sleep, and movement patterns that maintain insulin sensitivity over decades. The third is reducing chronic physiological stress, which directly elevates the long-term strain on cardiac tissue independent of diet.
Here's the question worth sitting with. If heart disease has been the leading cause of death in this country for decades and a slight statistical decline is being celebrated, does that suggest medicine has found the right answer? Or that it has been managing the consequences of the wrong food system for 50 years? Drop a comment and tell us where you land on that.
Thank you for listening to Dr. Mercola's Cellular Wisdom. See you in the next episode.
Looking for trusted health wisdom you can hold in your hands? Discover the life-changing books of Dr. Mercola at joyhousepublishing.com. These titles bring decades of natural health research into practical steps for better energy, stronger immunity, and clearer thinking. Take charge of your health with guidance rooted in science and experience. Visit joyhousepublishing.com now and claim your bonuses while they are available.
Thanks for watching. Subscribe now and click the notification bell so you never miss an update. See you in the next video.